Hi, my name is Kendall. I'm a nurse at the Total Joint Center of the Northland. I'm going to be giving you some information for your upcoming total joint replacement. Feel free to pause here, grab a pen and paper, write down any notes you would like. We should have sent you the guidebook online as well through your email. If you want to print that off, we can kind of go through that together during the video. Feel free to do that right now. And then share this with any caretakers that you'll have the day of surgery. Whether that's a family member or a friend, please send this over to them so that they can hear the information as well. If you have any questions or concerns, please don't hesitate to reach us at 816-499-8500. Just ask for a pre-op nurse and we'll get you taken care of. Lastly, if you would like to come into the center to go over any one-on-one instructions, we can do that. Just call and we will set that up. These first two forms we will have you fill out and sign before surgery. You can print these off and bring them filled out, or we can give them to you on the day of surgery. Next is your patient rights and responsibilities. These just ensure a partnership for mutual respect. These next pages go over your privacy practices such as HIPAA. Again, feel free to print or pause and read through these whenever it is convenient for you. We can also provide a copy on the day of surgery. This next page goes over some frequently asked questions, such as why is it so cold in here, and why we keep asking the same questions. This page goes over financial responsibility and who you could potentially receive a bill from. If you have any questions regarding this information, please don't hesitate to call us. Okay, now we can start talking about your joint replacement. Our name is the Total Joint Center of the Northland. We are located at 200 Northeast 54th Street in Kansas City, Missouri 64119. Here's a map of our location and a picture of the building. We are in Suite 200, so up on the second floor. There's an elevator or a staircase you can use to get up here, and we're the only ones on this floor. We are an outpatient surgery center, so you do go home the same day as surgery. The average length of stay is about 6 hours from checking in to going home. All of the nurses that will be providing your care on the day of surgery are registered nurses. You would have talked to one during your pre-op call, and we will call to check on you after surgery as well. This is a great way to make sure everything is going as planned and to answer any questions. You will also receive a number that you can call or text if you have any emergencies after the day of surgery. You will also see a physical therapist the day of surgery to do a one-time evaluation before you go home. This video is your pre-operative education session. Please share with anyone that will be involved with your care when you go home. We do require you to have someone with you for the first 4 days after surgery. We often refer to them as your coach because they will be heavily involved with your recovery process. It is extremely important to have someone mentally and physically able to help care for you. If you do not have that or you have questions about what that may entail, please contact us. Preparing your home beforehand is important so that you have less to worry about after surgery. Have a look around and pick up any throw rugs, move any obstructions from walkways, and ensure railings are nice and tight. If you have any stairs, inside or outside, that you plan to use shortly after surgery, it is highly recommended to install a railing for safety. You will be required to practice any stairs you have to do before leaving the surgery center. Look at your bathroom setup to make sure you are able to get on and off the toilet and in and out of the shower easily. Install grab bars or consider getting a toilet seat riser. It is also helpful to have a shower chair or something you can bring in to take a break if needed. 4 to 5 days worth of clean laundry is helpful, and make sure you have any necessities accessible. We sent an email with specific stop dates for your medications. Please refer to that and call with any questions. In general, we want you to stop any anti-inflammatories such as aspirin, ibuprofen, naproxen, and Aleve. We also would like you to stop any vitamins and supplements as these often contain blood-thinning agents. Other medications we might have you stop are often for blood pressure, diabetes, and weight loss. If you take any of these and we did not give you a stop date, please call the center. If there is not a stop date for a medication, then you can take it up until the day of surgery. Please do not take any medications day of surgery unless otherwise instructed. We will provide you with an incentive spirometer on the day of surgery. We often refer to this as a breathing device. You simply put the mouthpiece in your mouth, suck in like you were sucking on a straw, and hold for as long as you can. We have you do this exercise up to 10 times an hour for the first few days after surgery. This helps to prevent pneumonia and keeps you out of the hospital. On the day of surgery, please bring a copy of your driver's license, a copy of your advance directive if you have one, and a copayment if instructed. Assistive devices such as glasses or hearing aids will be needed to sign any paperwork and to listen to instructions. Please do not wear contacts, as we will need to remove them before taking you back to the operating room. Leave any valuables at home, including jewelry, and refrain from wearing any makeup or nail polish. Wear something loose-fitting and comfortable, as well as shoes with an enclosed back. Now we'll talk about shower prep prior to surgery. We will need you to shower with a special soap called HipaCleanse twice, the night before and the morning of surgery. You can get this soap at any pharmacy, or you can come in for a free bottle. When doing these showers, you want to use your regular soap for your hair, face, and privates. Rinse that soap and then turn the water off. Using the HipaCleanse soap, you will start at your surgical site and then cover the rest of your body from the neck down. Let the soap sit on your skin for 5 minutes and then rinse off. This soap is very drying, but it is important to not use any lotion or moisturizers afterwards, as that defeats the purpose of the soap. Once done, pat dry, put on clean clothes, and go to bed with clean sheets. In the morning, repeat the process. Please do not shave below the neck starting a few days prior to surgery. If you were to accidentally cut yourself, it is considered an open area and would increase your risk of infection. We do not want you to eat or drink anything after midnight the night before surgery. This includes water, coffee, and even chewing gum, unless otherwise directed. If you take a GLP-1, we want you to fast the day before surgery. You can have breakfast the day before, but only liquids the rest of the day, and then nothing to eat or drink after midnight. If you have a walker or cane, you can bring that with you on the day of surgery, otherwise the center will provide you with one. The walker we want you to use should look like this, with 2 wheels on the front and none on the back. We will teach you how to use the walker after surgery with our physical therapist. We will call you the day before surgery or the Friday before if your surgery is on Monday to give you an arrival time. On the day of surgery, you will check in with the receptionist and fill out any necessary paperwork. After that, one of the nurses will come and get you and bring you back to the pre-op area. We will get a quick wait for any waist-based medications and have you change into the gown. You'll come out and we'll get you connected to the monitor, fill out any paperwork and consents, get an IV started, and then bring your coach back. You'll have a chance to speak with your surgeon and ask any questions. You'll also talk to our anesthesiologist, and they will go through the process of putting you to sleep for surgery. We do a couple of nerve blocks before you go back to numb up your leg. It is important that you are awake for these so that you can communicate with us during the process. These nerve blocks help with pain control and the amount of pain medication needed during surgery, which results in an easier wake-up. The surgery takes about an hour and a half, and then your surgeon will come out to talk to your coach about how everything went. Recovery is different for everyone, just depending on how you wake up and how you feel. Since your leg will be numb from these nerve blocks, we do not want you to trust your leg the day of surgery. If you put weight through that surgical leg, it can buckle, which could result in a fall. When using the walker, you will push through your arms and use your upper body strength anytime you would usually bear weight through that surgical leg. It does not hurt to have a second set of hands other than your coach available if needed. If you think this may be an issue, please contact us and we can send you to prehab for a quick evaluation or talk about other options. We will go over discharge instructions, do a quick physical therapy evaluation, and when you are ready, you will be discharged from the facility. We will escort you out via wheelchair and help you into the car. After 24 hours, the initial nerve blocks wear off and you can put weight through that leg again. We will provide you with a gait belt to use after surgery and ask that someone is always with you, holding on just in case that leg were to buckle. It is very important, especially at night, to minimize the risk of falls. This is your pain scale. Pain is very subjective and different for every patient. The colorful scale is a little easier to use with more descriptive words that can help you decide your rating when asked. When we call to check in, we will ask your pain level. We would love to hear that you have no pain, but realistically, you just had a major surgery with a joint replacement, so unfortunately, there is some pain to be expected. However, we want to manage that pain as best as we can. Our goal is to have you in that 2 to 6 range for those first few days to weeks in recovery. We will give you instructions on what to do with your pain medication based on your level of pain. To keep track of everything a little easier, we will give you this log so you know when you took what medication and when the next one is due. Our surgeons typically prescribe oxycodone and tramadol, which we have you alternate every 3 hours. For example, if you take oxycodone at 12, then you would take tramadol at 3, and then back to the oxycodone at 6 and tramadol at 9. We do not want you to take these medications at the same time. It is recommended to eat something when taking these medications, such as a cracker or small snack. We also have you take Tylenol 3 times a day, as long as it is not already included in the oxycodone. The rest of this list is dependent on your surgeon. We will give you instructions and recovery based on what is prescribed. This is your shopping list for surgery. We want you to purchase these items before coming in. Miralax is a stool softener to help with constipation. Aspirin will be your blood thinner for when you go home. Most of our surgeons just use the baby aspirin, which is 81 milligrams. You will take the aspirin twice a day for the first 6 weeks. Tylenol will help with pain in combination with pain pills your surgeon will prescribe. Those pain pills are often called in the day before surgery, but if you do not receive them, don't panic. A nurse will call and verify that your pharmacy has received and filled those scripts prior to you leaving the center. Glad Press and Seal helps to keep your dressing clean and dry when you are ready to shower. Any kind of plastic wrap will work, or Amazon has shower covers if you prefer that. We encourage protein shakes or protein bars after surgery, as protein helps with wound healing. The name of the soap you will use for the showers is called HIPAA Cleanse. You can find this at any pharmacy, but if you prefer to come in for a free bottle, just stop in anytime before 2 p.m. Lastly, compression shorts are on here, and those are strictly for our hip patients, as it provides extra support after surgery. It is important to stay on top of the pain with the medications prescribed. It is easier to stay on schedule than to play catch up if you fall behind. If you have physical therapy, you will want to take something before going. Ice will be your best friend during this recovery process. We will give you an ice pack to go home with. Ice helps with swelling, which in turn helps with pain. Do not use any heat on the affected joint. Heat will bring more blood to the area, which increases swelling. You may not have the best appetite and may have difficulty sleeping after surgery, but this will get better with time. We will have you start a stool softener the day after surgery to help with constipation caused by the pain medications. There are multiple things we do to help prevent blood clots. The first is your aspirin included on your medication and shopping list. The second is compression stockings that you wear on both legs. You will wear these every day pretty much continuously until your follow-up appointment. It is okay to take them off for 1 to 2 hours a day when showering or doing sponge baths. We will provide you 2 pairs on the day of surgery. You will want to change these as needed and can wash them either by hand or in the washing machine. You should line dry them to prevent ruining the elasticity, so do not put them in the dryer. Your incision will be covered with a dressing such as the one on this screen. Underneath are dissolvable stitches and surgical glue. You will want to keep this dressing clean and dry until the follow-up appointment when they take it off. This is where the press and seal or shower covers come into play. You want to wrap it up nice and tight so that water cannot get underneath that dressing when you shower. Please keep an eye on the surgical site and let us know if you develop any drainage, redness, heat, or odor. We also want to know if you develop fever over 101 degrees. If this occurs, we will contact your surgeon and give you further instructions. You will not have any dressing changes to worry about unless otherwise instructed. We have already discussed a few of these potential complications, but to quickly review, signs of infection include fever, rash or redness, and odor with drainage. Signs of a blood clot include swelling in thigh, calf, or ankle, as well as pain, heat, and tenderness. If you have any concerns, please contact us and we will reach out to your surgeon. Blood clot prevention includes your twice daily aspirin, compression socks, walking, and ankle pumps. If you were to develop any difficulty breathing, chest pain, or irregular heartbeat, please call 911 immediately to be evaluated. Everyone's recovery process is a little different, but you want to protect your joint as best as you can. This means not scrubbing floors on your knees, watching for any uneven surfaces or hazards, avoiding open-toed shoes, sitting in chairs with arm support, changing positions slowly, and not lifting heavy objects until authorized by your surgeon. The next section talks about activities of daily living. We will go over these on the day of surgery with the physical therapist and what pertains to your setup at home.
Feel free to pause and read through each one or print the guidebook we sent and look them over. There are some pictures that show you more details, and it goes over standing from a chair, sitting, transferring in and out of the bed, getting in and out of the tub if you don't have a walk-in shower, how to use the walker when walking, stairs, getting into the car, and lastly, some tips to make personal care a little easier. We will answer any questions you might have and make sure that you feel comfortable going home. This joint replacement is a lifetime commitment. Infection prevention and safety are the top priorities. Most surgeons want you to wait at least 6 months before going to the dentist. They will likely prescribe a prophylactic antibiotic to take before getting any dental work done. Make sure your dentist knows that you had a joint replaced. You also may have to make changes to your regular exercise routine. This is a conversation to have with your surgeon at your follow-up appointment. Most high-risk and high-impact activities are discouraged. If you have questions about specific exercises, I recommend reaching out to your surgeon's office. You will likely see your surgeon multiple times after the surgery. Follow-up appointments are vital in making sure everything is still in optimal condition. The amount and timing of these appointments will depend on your surgeon and your recovery process. I want to thank you for sticking around until the end of this video. I also want to thank you for allowing us to be a part of this life-changing experience. If you have any questions at all, please call us at 816-499-8500. If you feel like you would benefit from sitting down and going over this information in person, please call and set up a class. Thank you again, and we'll see you soon.